Welcome to this explainer. Today, we're jumping right into a massive policy shift coming down the pike for U.S. healthcare. Specifically, we're looking at the upcoming 2027 changes to Medicare prescription coverage. Look, if you or a loved one rely on Medicare, you're definitely going to want to pay close attention to this because these changes, they could seriously reshape your monthly expenses.
Which leads us straight to the multi-million-dollar question that's honestly keeping a lot of seniors up at night. Are your Medicare premiums actually changing in 2027? Well, the short answer is yes. For a significant number of people, they absolutely will. And to really understand why that's happening, we have to take a look at the money that's currently holding those premiums down.
$3.6 billion. That is a massive number, right? That represents the estimated subsidy going directly to insurance companies this year alone. Now, the whole purpose of this money has been to basically act as a shield, blunting the premium increases from Medicare prescription plans, which you probably know as Part D. However, the Trump administration recently announced plans to eliminate this exact subsidy program, and that is setting the stage for some pretty major market shifts.
So here's our roadmap for today's explainer. We're going to cover the Part D subsidy sunset, the impact on senior premiums, the administration's argument, why costs are rising, and finally, the shift toward Medicare Advantage. Let's dive in.
Section 1. The Part D subsidy sunset, or in other words, the end of a multi-billion-dollar program.
Okay, so according to a report from the Government Accountability Office, an estimated $9.8 billion was pumped into this market to act as a sort of financial shock absorber. The breakdown over time is actually staggering. We saw a $6.2 billion subsidy in 2025, dropping to $3.6 billion in 2026, but by 2027, the faucet turns off completely. According to administration officials, the program is simply not being renewed after 2026.
So who exactly is caught in the middle of all this? Roughly 25 million people. That's how many individuals currently hold these Part D plans. And the absolutely crucial point here is that they won't have to wait until January 2027 to feel the impact. No, these 25 million enrollees are going to learn about their new 2027 rates in the fall of the preceding year. So the clock is ticking a lot faster than it might seem on paper.
Moving right along to Section 2. Impact on senior premiums. Let's look at what this actually means for those 25 million enrollees.
Now, the administration's projections show that this isn't going to be just one uniform hike across the board. For about 25% of enrollees, premiums are actually going to stay flat or maybe even drop a bit next year. Another 30%, they'll see a slight increase of less than $10 a month. But for the largest chunk, 45% of enrollees, you should expect to see somewhere between $11 and $20 added to your monthly bill.
To really understand the weight of that $11 to $20 increase, we need a little context. According to KFF, which is a health policy nonprofit, the average premium for a Part D plan was hovering around $36 a month this year. Think about that. When your baseline is just $36, a sudden jump of $11 to $20, that is a massively significant percentage increase, especially for someone who's managing a very strict monthly budget.
So what's the administration's advice for avoiding that hike? Well, shop around. They maintain that affordable options are absolutely still out there, provided you're willing to roll up your sleeves and put in the legwork to switch plans.
Which brings us to Section 3, the administration's argument. Why end the subsidy right now?
The administration basically frames this subsidy as an unnecessary government intervention. We can actually see this perspective pretty clearly in a recent public statement made by Mehmet Oz, the administrator of the Centers for Medicare and Medicaid Services. He stated flat out, "We are stabilizing the market so this bailout is no longer needed."
Let's unpack that rationale a bit. They argue that these subsidies essentially created a perverse incentive. The idea is that insurers were raising their rates knowing full well the government would just step in and pick up the extra cost. By removing this financial crutch, officials believe the market is going to correct itself. And they also make a point to note that other, separate policies designed to hold down Part D costs, those will remain firmly in place.
There's another big piece to this. Officials claim that if the program continued into next year, more than half of all that subsidy money would have flowed to just one single company, United Health Group. Now, in response to that framing, a spokesman for United Health Group countered by stating that the company remains committed to working with CMS, ensuring seniors have access to affordable prescription medicines. But this back and forth really highlights the administration's deep concern over where exactly these billions of taxpayer dollars were ending up.
All right, Section 4. Why are costs rising in the first place? Let's look at the underlying pressures driving up drug costs.
Juliet Kabansky, a vice president over at KFF, points out that these underlying market pressures are expected to continue right on into 2027. And there are really two core factors driving the bus here. First, you have the exploding demand for GLP-1 medications. Yes, those are the wildly popular weight loss and diabetes drugs that literally everyone seems to be talking about lately. Those are costing plans an absolute fortune. Second is the 2022 Inflation Reduction Act. Now, while that law has successfully capped out-of-pocket costs for seniors, which is great, it also forced insurers to shoulder the difference. And that fundamentally pushes up the premiums.
To really see how much this subsidy masked those true costs, we can look at some federal watchdog data. It shows the subsidy artificially slashed the average premium by 40% in 2025 and by 27% in 2026. But in 2027, that reduction vanishes completely, 0%, which means those true underlying costs are going to hit the market directly.
This brings us to our final part, Section 5, the Medicare Advantage shift, insurer pullbacks and changing choices.
You know, the craziest part is that the market is already contracting. Despite the billions of dollars in extra funding pumped into the system over the last couple of years, the actual number of drug plans being offered has plummeted by 50%, literally cut in half in just 2 years. Insurers are simply walking away from these standalone plans. Because of all this, seniors are essentially standing at a crossroads facing two diverging paths. On one hand, you stick with a standalone Part D plan, where options are shrinking and premiums are, on average, rising. Or, on the other hand, you look at Medicare Advantage. That's the private, bundled alternative that wraps your medical and drug benefits together. And crucially, they often charge a $0 premium. Because of these intense financial pressures, experts are predicting a massive migration of enrollees, moving away from traditional Medicare and heading straight into Medicare Advantage.
So, with the 2027 sunset of these premium subsidies, the true cost of prescription drug coverage is finally bubbling up right to the surface. And it leaves us with a pretty critical question to ponder as we watch this whole market evolve. As standalone options continue to shrink and become more expensive, will bundled Medicare Advantage plans eventually become the only viable choice left for seniors? It's a huge question. Thank you so much for joining me for this explainer today, and please make sure you keep a really close eye on those fall enrollment notices.